Well, good afternoon, everyone, and welcome to today's webinar on healthcare reform in California. How did we do in year one? I'm Gerald Kominski. I'm professor at the Fielding School of Public Health here at UCLA. I'm also director of the UCLA Center for Health Policy Research. And it's a pleasure for me to talk to you today about year one success for healthcare reform and the Affordable Care Act. So, almost 4 years ago, a little more than 4 years ago, President Obama signed the Affordable Care Act into law, as shown in this photograph. And I think that what history will show, and what has been interesting about this law, is the long lead time between the signing of the legislation 4 years ago and the implementation of the major provisions of the law. It's been almost 4 years before the major elements of the law went into effect this year. And everybody who's on this webinar certainly knows the difficult path that we've seen for the full implementation of this law. The fact that there was such a long lead time provided ample opportunity for opponents to the law to mobilize, to continue to fight against it, to implement, or I should say engage in strategies to delay implementation at every turn. And this law has now survived not only a constitutional challenge, it's survived basically a second referendum during the presidential campaign of 2012, and it looks like we're poised for it to undergo a further referendum during the midterm elections. It's a little unclear. We're getting conflicting reports in the news about whether or not Republicans are going to strongly campaign against the Affordable Care Act in the fall election. Recent news stories suggest that there's division within the Republican Party, but I think one thing we can be sure of is that there are certainly the most conservative right-wing elements of the Republican Party, and the Tea Party candidates are likely to campaign aggressively against Obamacare in the fall election, and in certain areas of the country, in certain legislative districts, that will resonate with voters in those districts. But it does look like there's beginning to be some division within the ranks of the Republicans about whether or not it's a lost cause to continue to campaign for repeal of what looks like a tremendously successful first year for enrollment. So this is just a reminder of, in California, of Covered California's website. And the reason I show you this is, first of all, to remind everybody that the open enrollment season is closed now. But as the website is reminding us, Medi-Cal enrollment continues year-round. And furthermore, enrollment will continue through the year for people who have changes in their life events that make them eligible during the course of the year, or changes in their circumstances that allow them to qualify for different benefits. In work that has been done by colleagues of ours at UC Berkeley, we expect there to be churn in the population that's enrolled in Covered California during the course of the year as people's circumstances change. So there will be people leaving the exchange because they get insurance through their place of employment, or they have a change in income and either their income increases so they're no longer eligible for subsidies, or their income goes down and they now qualify for Medicaid. So we do expect churn, but there will be people coming into the exchange for similar reasons during the course of the year because of changes in life circumstances. The other point that I want to make about Covered California is that in contrast to certainly healthcare.gov website, which was used by 36 states, Covered California as a state-based exchange and website was one of the most successful, if not the most successful in the country. Having said that, there were also flaws and glitches in the Covered California website during the course of open enrollment season, most of which were addressed successfully. Probably the most sort of the one problem area that will need the most work is the provider networks. And that part of the website was working and then taken down a couple of times during the course of the open enrollment season. But for the most part, Covered California's website was a great success and facilitated the large enrollment numbers that I'll be talking about a little bit later in the presentation. The other thing I wanted to point out about Covered California and its website that I found particularly useful from the beginning and should have been a feature of all of the websites, including healthcare.gov from the beginning, is the shop and compare tool that you see down in the lower corner of the website. This feature, which just common sense tells you should have been on every website, allowed individuals to go onto the website and literally shop for coverage, to look at all of the available policies within a market area, given your income status and your family size. Healthcare.gov, in contrast, at least at the beginning, required you to establish an account. And I did spend time, I went onto the website, healthcare.gov, early on in the open enrollment period. And the process of establishing an account was not an easy process. It took quite a bit of time to set up that account. And what I was really interested in doing was looking at premiums, not in necessarily providing lots of personal information or having my background checked. It appeared that I was basically undergoing what is equivalent to applying for credit, given the kinds of questions that I was being asked. So that process I experienced as both frustrating and unnecessarily time-consuming, and it's not surprising to me that people who were genuinely looking for insurance, as opposed to just a curious investigator, it's not surprising to me that people would find that process frustrating and perhaps give up. This slide is just a reminder of the metal tiers that were offered this year. And specifically in California, what I want to remind you in the audience of is that California went above and beyond the requirements in the law itself. So California, the law requires the exchanges to offer 4 metal tiers, and those metal tiers are defined based on the proportion of total cost paid for by the premium versus total covered expenses paid for by out-of-pocket spending. So the bronze plan is the most affordable on a monthly basis. It has the lowest premium or premiums, and is on average expected that premiums will cover 60% of total covered expenses. Out-of-pocket spending would cover, on average, 40%. At the other end of the spectrum, the platinum plan covers the premium covers 90% of covered expenses, and out-of-pocket spending would cover on average 10%. But California went one step beyond the requirements in the law, and the California legislature required the 4 metal tiers to have standardized benefits. And specifically what I mean by that is, of course, the federal law requires all plans to have the same essential health benefit package, regardless of tier. But California's legislature required the 4 tiers to have standardized payment or co-payment structures, and those are what are displayed in this slide. So every bronze plan in California had a $5,000 deductible, $60 co-payments for primary care visits, $19 co-payments for generic medication, and $6,350 maximum for individual annual out-of-pocket spending. By standardizing the policies in this way, so that every insurer's bronze plan had the same structure, this facilitated apples to apples comparison shopping in California in a way that wasn't necessarily available in other states. And I did spend some time looking at the policies, the bronze plans and silver plans, gold plans offered in some other states, for example, in Arizona. Obviously the bronze plans were all similar in terms of their co-payments and deductibles, but there were minor variations, and it really raises the question I think we'll see next year, for example, in states that didn't standardize the co-payment structures the way that California did. It'll be interesting to see whether or not in those states, whether we have as many plans offered. I almost feel that insurers were offering a wide variety of minor variations of bronze plans to see which one would be most popular, and then are likely to drop the ones that had smaller enrollment next year. This slide shows the premiums for all metal tiers in Los Angeles County this past open enrollment season. And I want to use this slide to illustrate a couple points about how comparison shopping was facilitated by the exchange and by Covered California. First of all, we've got standardized policies, so we know that the deductibles and co-payments are the same. And you can see that within each of the tiers that there is some price variation. So you've got essential health benefits, all the policies have the same essential health benefit package. They all have the same deductible and co-payment structure, but they do differ in some cases, and when we get to the platinum plans, differ somewhat considerably in the monthly premiums before subsidy. So one point that I want to emphasize is that the major difference, once you've standardized the benefits and standardized the structure of the co-payments and deductibles, the primary difference between these plans are the networks, the provider networks. And that ends up being one of the major drivers of the premium differences that we see displayed in this table. The other point that I wanted to make about this is that one of the concerns initially about the exchange was whether or not how the pricing would be relative to the current, or I should say the previous individual insurance market. In general, I think that analysts felt that the premium structure was lower than expected. And in order to make that comparison, of course, we'd need to have similar data from 2013 in the individual market. And of course, that data, or those data, are not readily available. So it's kind of difficult to make a fair comparison between last year's market premiums in the individual market and this year's premiums, because last year's premiums weren't readily available in the same way that they are today. So one of the things we've done, and this is, I think, a major accomplishment of the ACA, is we've increased the amount of transparency there is in the market, because we can now, I can display a table like this that would have been virtually impossible to display last year because of the wide variation in the products offered, as well as the difficulty in identifying what the various premiums that were charged for those products were. But the other point that I want to make is based on the information at the bottom of this slide. This hypothetical couple in Los Angeles County, who shall go unnamed for confidentiality reasons, also currently have employee-sponsored insurance that costs $1,280 a month. And that employer-sponsored insurance, of course, is heavily subsidized by the employer, so that this couple pays $342 out of pocket. So obviously, this is a better deal. This couple would not qualify for a subsidy on the exchange, and if they did not have employment-based insurance, would be paying the full premium. But what I want to emphasize is that the premium paid, or the total cost of insurance for this hypothetical couple, is pretty similar to the, it's basically between the gold and platinum premium that HealthNet offered in Los Angeles County this past year. And I think that that's a really significant finding for the following reason. What it says is that the premiums in the exchange were comparable to premiums, at least in this very limited example, similar to premiums that were offered in the large group market. And I think that that's really, although this is obviously an N of only one, I think that to the extent that this is indicative of how affordable premiums were in the exchange, that it means that health insurance really was significantly more affordable, even in the absence of subsidies. It means that the premiums really were now approaching the level in the large group market. I think most analysts would agree prior to the ACA that in general premiums in the small group market were in some cases significantly higher than comparable policies in the large group market. So I think this is another indicator of the success of the law. So how did we do in California? I think that many of you already have seen these numbers. This is a slide directly from a presentation given by Peter Lee recently. And the answer is California did an outstanding job of enrolling people. Almost 1.4 million enrolled through the exchange, and about 88% of those with subsidies. With regard to Medi-Cal enrollment and expanded Medi-Cal, about 1.1 million people were newly enrolled in Medi-Cal, and another 650,000 transitioned into Medi-Cal from what was called the Low-Income Health Program. And for those of you who aren't familiar with this program, this is a program that has been supported through a Medicaid waiver here in California for the last 3 years. It enrolled individuals who were uninsured but not eligible for Medi-Cal prior to 2014 into county-based programs. The counties expanded their indigent care programs to qualify for this program, and every dollar that the county spent for individuals enrolled in this program was eligible for matching funds from the federal government. So this was a transitional program and was presented as such by the state to CMS as a bridge to healthcare reform. And the 650,000 people who were in this program as of December relatively seamlessly transitioned into Medi-Cal on January 1st without having to sign up through the exchange. So this is also, I think, in my opinion, a huge success story for California, and facilitated a significant increase in Medi-Cal enrollment without having to go through an application process in the exchange. So the numbers are outstanding, and I think that Peter Lee and the staff at Covered California deserve huge credit for pushing enrollment figures as high as possible to the very end of open enrollment season. This slide just shows some of the breakdowns. I think many of you on this webinar know that here at the center, we've been collaborating with colleagues at Berkeley to develop a model called CalSim. And CalSim, we've been using CalSim for the last 2 years and working with Covered California to estimate both eligibility and likely enrollment in the exchange in California. Our original projections, we developed 2 sets of estimates for Covered California, a baseline and or a base model and an enhanced model. And although Covered California took our estimates and made some modifications to them, they used in most of their targets our base model estimates. Personally, I've always felt that California would probably meet the enhanced model targets, and in fact, our enhanced model predicted that 1.2 million people would be enrolled this year in the exchange with subsidies. And just to go back to the previous slide, we pretty much hit that total number on right on the head. However, when we look at the enrollment by age, for example, although California did a good job in enrolling young people, there's been still speculation that not enough young people are enrolled. I personally am not convinced that there's a problem in California, but I think that we'll know better in another month or so when the premiums for next year are proposed to Covered California by participants in the exchange. There's been a lot of discussion that the exchanges needed to enroll at least 40% of young invincibles, at least 40% of their enrollment needed to be young invincibles to make the market stable. I've doubted those numbers for a long time. Certainly California did not meet that target, but was closer to about 29% enrollment among those between 18 and 34. But I think we'll see within the next month whether or not this has a significant effect on premiums in the next open enrollment season. One of the reasons I'm optimistic that it will not have a significant effect is that we've seen that a number of people in the exchange have enrolled in in silver and bronze plans. Because those plans are relatively high deductible plans, I suspect that those high deductible plans will have a dampening effect on healthcare utilization among people in those plans, and that will moderate the growth in premiums for the upcoming season. But it's clear that, although I don't show in this slide the comparison between our CalSim estimates and the final enrollment figures, our projections did show a larger proportion of young adults 18 to 34 than actually enrolled. So it's quite clear that older adults, 45 to 64, were much more likely to enroll overall, and more likely than we originally projected. Also want to comment a little bit on the distribution by ethnicity, because this is another area that, or another issue that generated concern in California, and that is the perception that enrollment among Latinos and African Americans were lower than projected. There clearly was a surge in enrollment among Latinos in particular during the last 4 to 6 weeks of the open enrollment period. And it's my understanding that part of the reason for that surge in enrollment was increased advertising and outreach through media outlets targeted to Spanish-speaking populations. So I expect, and I believe that Peter Lee has already commented that the Covered California will need to review its outreach strategies for the next open enrollment season, and can probably do a better job of outreach to Latino and African American communities. But I think that there's plenty of room for celebration. I've had a number of reporters call me in the last week or two to say, how did we do and what can we do better for next year? And I said, you know what? There's probably room for lots of improvement, but let's take a week and celebrate. I think the president deserves to be able to celebrate having 8 million people enrolled through the exchanges, exceeding both the original target of 7 million, as well as exceeding the downward revised target of 6 million as a result of the difficult rollout of the website. So the fact that we got to 8 million nationally tells me that the Affordable Care Act is already working, that people want affordable insurance. They had access to affordable insurance, and despite all of the negative publicity, despite the flawed rollout of the federal website, despite all of that, there was an overwhelming response in year one. I think there's plenty of room to celebrate, and I congratulate everybody at the state and federal level who worked so hard under extraordinary time pressure and extraordinary political pressure to get this program off and running. But as everybody in the audience knows, the political divide that we face in the country, in some sense, feels as great as it's ever been, and certainly the year one success of the Affordable Care Act and Obamacare has not necessarily done anything to narrow the chasm that we experience politically. In fact, it may have continued to increase the divide. And Republicans have certainly indicated in their rhetoric that they're ready to compromise with the president on all opportunities. But as illustrated in this slide, they'd like the president to take the first step and watch it. It's a long way down if you meet us halfway. This, as I alluded to earlier at the beginning of the presentation, this will be an interesting year, and we're already seeing in the last week or two some divide within the Republican Party about whether to continue to fight for repeal of Obamacare. It will resonate with some audiences, but we may see the first cracks in this repeal at all cost strategy, and we may in fact finally beginning to turn the corner on whether or not to fight for repeal versus let's find out how to make this law work as effectively as it can. And I just want to close by showing you a few slides and a little bit of data to support what I think is an optimistic perspective or outlook on the immediate future of the ACA. Kaiser Family Foundation has been doing public opinion polling on the Affordable Care Act since actually shortly before it was enacted. And one of the latest polls, now this is a few months old now, it's from January, indicate that the majority of individuals in their poll believe that the law should be accepted and approved. There's still obviously a strong opposition, but it's not the majority at this point. Among those who have a favorable opinion of the law, fully 88% believe that the law should be improved rather than repealed. But even among those with an overall unfavorable opinion, 31% report that they feel the law should be maintained, but we should work to improve it. So I see reasons for optimism in these public opinion polls. But as I mentioned, Kaiser's been tracking this, and one of the interesting phenomena surrounding the public opinion on the ACA is the fact that as open enrollment season got underway, we saw a pretty dramatic increase in the unfavorable or negative perceptions of the ACA. And that's so I'd like to focus your attention on that red circle there on the right-hand side of this graph. And you can see that for 4 years, the favorable and unfavorable perspectives have been sort of bouncing back and forth, roughly even for the last 3.5 years. And then suddenly we see this almost, I described it in a recent talk, almost like a shark's jaw opening up as open enrollment season. And obviously we all know why this sort of unfavorable perspective might have spiked in November and January. So many problems with the rollout of the federal, so much negative publicity. It's not surprising that that kind of negative attention and daily negative reporting would lead to a spike. But I want to close by showing you another slide that is remarkably similar, and that is the public opinion regarding the Medicare Part D benefit. And although Part D is not a perfect comparison with the Affordable Care Act, there are similarities and some important similarities. Part D benefit was enacted in 2003, but not actually available to beneficiaries until 2006. So shortly after the law was enacted in early 2004, you can see that public opinion about the Part D benefit was highly unfavorable, outnumbering favorable opinion almost 3 to 1. And that narrowed gradually over the course of the next year and a half until right before open enrollment, the first open enrollment season in August of 2005, when finally there was basically even opinion, favorable and unfavorable perspective. And then look what happened immediately as open enrollment season opened. We saw this huge spike in negative and unfavorable opinions about the Part D benefit, and the same sort of opening of the jaws between favorable and unfavorable opinions. But by the end of open enrollment and 6 months into the first year of benefits under Part D, you can see once again that gap had closed and then started to trend favorable by the end of 2006, the first full year of benefits. And at that point, Kaiser Family Foundation, which was doing this polling, stopped um, for reasons that are unknown, certainly to me. They may have thought that this was we're moving on. The law is underway, and but someone had the foresight, or maybe the hindsight, to say maybe it's time for us to look at where we are now, 7 years into this program, and see now what public opinion is about Part D. Now that it's been in place, people have become familiar with it. It's been in operation and working. What's the public opinion about this now? And you can see that when Kaiser asked this question again as part of their public opinion polling, 63% of people polled had a favorable impression in November of 2003. So the optimist in me feels that the slide that I showed you previously, and I'll just go back quickly, that if we project those lines out, I think that we're likely to see over the course of the next 5 to 7 years the same sort of gradual favorable trending and unfavorable perspectives on the ACA diminishing, hopefully rapidly over time. So I'd like to thank you for participating in the webinar today. I apologize that we don't have a Q&A enabled at this time, but it's my understanding that I'll be able to respond to your questions offline, and if you'd like to send your comments or questions to me, I'm happy to respond. You can send those to healthpolicy@ucla.edu. Thanks for your attention today. It's been my pleasure to talk to you about this year's successes under the ACA, and I'm looking forward to even greater success in the second open enrollment season, which